So I'm going to have a quick chat with the rapid response team. And first of all, we start by introducing myself. I'm Guenael Rodier, and I'm the director of a program dealing with country health emergency preparedness and international health regulations. I will start with giving you a story about One Health and why we have to look at both human health and animal health. I studied WHO directly with an outbreak back to 1994 in the city of Surat in India. And at that time we had a plague outbreak. But what was interesting as we investigated that the plague outbreak was due, of course, to domestic rodents, rats, being sick, living where they live and going into the street. And then when they're dead, the fly then bite human being coming around. But why this domestic rodent started to be infected? They are not the animal reservoir. They were actually infected because of floods, which move the wild rodent reservoir in contact with the domestic rodent. So the domestic rodent plays the role of vectors. But to understand the entire outbreak, we needed to have this understanding of both what was happening at that time in the human population, but also how it was also spreading within the animal population, in that case, the domestic rodents. So that was maybe the first element that brings the two things together, human health and animal health, for my experience in WHO. The second one was in 1997. It was in Gabon, and in the outbreak of Maïbout force, which is in northeast Gabon, we have an outbreak of Ebola. And this outbreak of Ebola was linked to actually a chimpanzee found dead, and then butchered by a number of young people, adolescents. And all of them get sick. All the women who cook the meat in the village get sick. But what was also interesting is that the chimpanzee was also the victim of Ebola. It was not the animal reservoir, and the animal reservoir, as you know today, is bats playing a key role. So with these two experiences, it was already very clear that when we deal with emerging or re-emerging diseases, that it's hard to understand the full picture unless we touch both the animal and human populations. As a director of what used to be actually since 2000 the program on emerging diseases and on the response, I was also involved in the response to SARS outbreaks, severe acute respiratory syndrome in Asia back to 2003. So we learned a lot about the value of this relationship, and I'm very keen to have this relationship, for instance, between WHO, OIE, the Organization for Animal Health, and the FAO. And we have actually that quite formalized with a tripartite agreement, which allowed, like we had this year, a meeting of senior manager of both WHO, OIE, and FAO coming together for some joint work. It's very important also to set up, for instance, information exchange between OIE, which has its own system for reporting on animal diseases, which is called WHE, and what we do within WHO under the international health regulations, the notification of diseases and everything around actually epidemic intelligence. We, as a director, have also de facto been created within the department a team dedicated to this interface called One Health. And this One Health team is within the department and ensure that this day-to-day interface between WHO and OIE and FAO works together. We also involve very much, for instance, our colleagues, veterinarian colleagues, into our activities of joint external evaluation, which assess the capacities in countries. So we assess the capacity in the human Ministry of Health areas, but also now with the veterinary sector. And in fact, OIE has its own instrument called the PVS, Performance of Veterinary Services, which we complement their work, but the fact is both sectors have a way to assess their capacities, and that come together under the joint work, and particularly the national planning, when we plan to fix a number of gaps that has been identified. We have actually also, under the international health regulation, a number of emergency committees that are extremely important because they look at a particular event. And I will just mention 3 of them where we had actually the animal sector represented. One was in line with the H1N1 outbreak or pandemic of influenza, one on Ebola, and one on MERS. And we had in many of these emergency committee under the IHR, not only physicians, epidemiologists, public health experts, but also entomologists or veterinarians that really contribute. So this being said, I will just want to stress the importance of this intersectoral work between human and animal sectors. I will just mention that this is important for emerging diseases. We also need not to forget another sector which is important for the international spread of diseases among humans, which is the sector of transport. Airlines, etc., play a key role in international spread. Now let me tell you what it means in practice for the rapid response team working intersectoral, especially for One Health. First of all, is to realize that human health is part of a much larger, I would say, environment where we are part of a one world, which means humans and animals. Animals being insects and being mammals and many others. So the second thing is, when you have understood that and you're dealing with an outbreak where obviously the animal kingdom is involved, number one is to make sure you have actually the Ministry of Agriculture, for instance, part of the investigations. It may not be you at the rapid response team to set it up, but you need to make sure somebody at the government level is going to bring in the Ministry, for instance, of Agriculture. Sometimes it could be Ministry of Wildlife, it could be sometimes municipalities. If I look at stray dogs for rabies outbreak, for instance, stray dogs belongs to nobody, and usually you have to work with the municipality to address the problem of the animal reservoir and vector of rabies when it's with stray dogs, for instance. This, I would say the second thing is when you organize a response and you distribute the roles, you should have someone who actually look at this role of looking at beyond health, looking at the environment. Just recently in the Ebola outbreak in Guinea, for instance, we had a report of, let's say, 50 dogs dying of Ebola. Ebola has never been reported to be a problem with dogs, but we started to investigate and we managed to have actually someone who focused for 1 week only on this information to see if after all we didn't have another victims or reservoir of Ebola and if dogs could play any role. In fact, that played no role at all, but the simple fact that we kept an eye on this was important to have the proper and complete picture of the outbreaks. So we say make sure if it's international, you have international colleagues on animal coming from FAO, coming from OIE, for instance. At national level, making sure you have Ministry of Agriculture involved, and at your team level, don't hesitate to bring on board a veterinarian or an entomologist. This is totally natural to keep the full picture of a particular event.